friends, I'm Dr. Biren Nadkarni. I'm a consultant orthopedic and hip and knee surgeon. I'm practicing at Sitaram Bharati Institute and Holy Family Hospitals, New Delhi. Let us see how the normal hip functions, and I'm just going to show an X-ray which shows what a normal hip joint is, and thereafter we are going to discuss what a hip replacement is and what are the problems which actually require hip replacement surgery. So if we go to this X-ray, where we are showing a normal hip joint X-ray, where the hip joint is basically formed by a ball and a socket, and this ball moves within the socket to form a ball and socket joint. The space between the ball and the socket is basically occupied by the cartilage, which is a soft tissue which allows the lubrication of the joint. But as we lose the cartilage, the situation sometimes becomes like this. This is what we call an arthritic hip. You can see the space between the ball and the socket is reduced. There are some cyst formations, and this is what has happened after arthritis of the hip joint. So what are the common causes of hip pain? Hip pain is a big problem basically with a lot of people, but the problems are not only arthritis. There are some basic issues like bursitis, tendonitis, which is basically inflammation of the soft tissues around the hip joint. It could be because of repetitive overuse or because of trauma. Then the other problems could be some kind of a pinching of the nerve, which we sometimes call as meralgia, in which the patient presents as hip pain. And so the causes are varied. Every hip pain is not arthritis. Each hip pain has to be worked up and seen clinically to make out what exactly is the cause of the hip pain. Sometimes we see hip pain as a cause which is coming from the spine. So there are referred pains from the spine, which is also causing hip pain. So hip pain has to be worked up. And what is the workup required? We do need basic X-rays. We need sometimes MRIs to see, and CT scan can also be made out. And one cause other which we have left out is basically a fracture. A fracture could be an occult fracture, just a small tripping, especially in osteoporotic people, where significant trauma has not happened, and patients complain of hip pain, even despite a trivial trauma. And they complain of hip pain, they are not able to work weight bear, they are not able to walk, and they are not able to sleep because of the pain. And once you do an X-ray and sometimes an MRI, we can actually see a occult fracture which is lying there. But the topic for today would be hip replacement. And what are the causes which actually need hip replacement? All these problems which we have discussed, tendonitis, bursitis, meralgia, these are manageable by basic medications and physiotherapy and some modifications of activities. But once we mention about arthritis, which is basically loss of cartilage, loss of space between the normal ball and socket joint, either it could be primary because of aging, degeneration, something which we don't see very commonly in India, but it is more secondary osteoarthritis, secondary to other problems like avascular necrosis of the femoral head, like previous trauma, like an old fracture, which has led to this. Then the pain becomes very disabling. The sleep becomes disturbed. The patient's daily activities of living are basically disturbed. And that is the time we have to consider a hip replacement. So is hip replacement for you? Hip replacement is basically indicated once the patient's pain and disability has gone beyond the stage where basic medications, activity modification, and other things are not helping. The patient's activities of daily living have gone to a stage where basic activities of going to the washroom, coming back from the washroom, getting up from the bed, coming back to the bed are suffering, and he requires almost daily painkillers to go through the pain, to get through the pain. So hip replacement is indicated for such patients. Age is a big criteria. There used to be a criteria of delaying the surgery as much as possible and trying to do it at a time when patient's age allows that, because the implants was not conducive enough to last a whole lifetime. But with modern alloys and modern implants, this surgery has been done for younger patients also, where patients are not, we cannot wait that long to prolong or postpone the surgery to about the age of 55, 60, because we see patients in as early as 40, 45 and 50s having their hip pains. either because of secondary osteoarthritis, or nowadays we see a lot of avascular necrosis of femoral head, especially after the COVID pandemic, where patients have used steroids for the management of the COVID complications. So, if you ask me who are the right candidates for surgery, right candidates of surgery basically are the patients who have taken a fair trial of medications. They have done enough physiotherapy. They have done other activity modifications. They have tried to maintain a healthy lifestyle in a body habitus and high BMI and a low BMI, which basically has helped them carry out. But all these measures have not helped them in reducing their pain. So it's basically the last resort for management of osteoarthritis. But sometimes we have to take an early call and we have to go ahead for a hip replacement procedure, which is a very gratifying procedure, and patients feel very, very thankful after doing this procedure. So, what do we do in a hip replacement procedure? And as we can see in this X-ray, this is only a 34-year-old patient who had severe arthritis secondary to avascular necrosis of femoral head. And as we can see, the joint space is reduced. There are some cyst formations in the head, and it's a very disabling condition for the patient. He has had all possible medications and systemic interventions, but he has not responded to that, and he was in severe pain. That's why he was recommended a hip replacement surgery. And what we do in a hip replacement surgery is basically we have to change the ball and the socket both. And as the model shows, so if we see this, the shaft, the femur, we have changed the ball, we have put the stem inside the canal of the thigh bone, and we have put a femoral head or a prosthetic head on top of this shaft. So this is the replacement of the ball side. And as we go to the socket side, we have placed the socket here. So we have changed the socket and the ball both, and this is what we call the hip replacement. So I hope you have gathered enough information from this video about the procedure. And there are various varieties of hip replacement, technicalities of which are basically you can only discuss with your doctor who has advised you of this procedure. And if you need any information about this procedure, if you have been advised this procedure, and if you think you are waiting for this procedure, please do write to us.